Hey folks, I'm here with Dr. David Rabin. He's a board-certified psychiatrist and neuroscientist who specializes in the treatment of chronic stress. He's the co-founder at Apollo Neuroscience, a wearable device and platform that helps you manage stress on the spot. And one thing I want to mention is that I've had the pleasure of enjoying the Apollo device for almost 6 months now, and I've logged over 15,000 minutes of active wear in-app. It's definitely improved my sleep, podcast performance, ability to tolerate and even prevent stress. It's improved my public speaking skills and a lot more. And it's hands down, no pun intended, the single most influential personal health technology that I've used. And so here we are with one of the co-founders, Dr. David. Welcome to the show. It's such a pleasure to have you here.
It's a pleasure to be here with you, Andres. Thank you so much for having me. And I'm so glad to hear that you are having such a good experience with Apollo. I use it every day as well. And it's really been a game changer, particularly on the public speaking and presentations note that you mentioned earlier.
You know, I had a couple questions that I wanted to start with, but why don't we start there? Can you tell me a little bit about your public speaking journey? If I've learned correctly, I think you had some trouble as a public speaker, and I can definitely empathize with you there. So can you tell us a little more about that and how Apollo has helped you?
Absolutely. So I mean, I think it's fair to say that speaking in public or presenting in public is actually one of the biggest fears that most people in the Western world have when they're asked, what is the thing you're afraid of the most? It's standing up in front of other people and presenting something, which is really interesting. And, being in the academic and medical world, we are no strangers to that. We have to do a lot of practice presenting, and we present a lot, but we're generally presenting in front of a bunch of peers or colleagues, people who are very, very bright, much of the time brighter than, or more knowledgeable than we are about what we're presenting, who ask very intense critical questions and, sometimes try to really stick it to you when you're presenting. And even if you know your stuff, there's always a, slight concern that somebody in the audience might really send you some zingers. And so, naturally all of us in our medical training, almost all of us have at least some little bits of nervousness around public speaking, no matter how much we practice. And I was no different than that. And what I realized was that I never actually was able to get a handle on the last bits of nervousness that I had, which was effectively me thinking about what other people were thinking about me while I was talking. And so I kept doing that and not realizing that I was doing it because I had been doing it for so long. And then when we developed the Apollo prototypes, the first prototypes back in 2017, I started to use it all the time because we wanted to see what the technology was doing for people in different situations. And I knew it helped me feel calmer and more focused. So I thought, well, let's start using this during my public speaking engagements and my presentations. And I did. And it made me so it made me, first of all, feel sort of more in touch with my body and my breath and feel calmer and safer in public speaking situations like it did in other situations that were stressful. But the thing that made me the most aware of was that process that I mentioned earlier, that I was spending a lot of time on stage thinking about what other people were thinking about what I was saying and thinking about me, what people were thinking about me. And in that moment of presentation, I realized that that's such a silly thing to waste my precious cognitive resources thinking about, because it's not useful to me. These people are here to hear me talk, and I'm going to give a better presentation, much, much better, if I am just present with my presentation and I'm in the moment talking about what these people are here to hear me talk about. And so as soon as I did that, as soon as I kind of made that recognition when I was wearing the Apollo in one of my first early presentations, which was actually presenting on the Apollo work itself, I realized that this freed up like 30 to 40% of my cognitive resources, during presentations, because that's how much energy I was putting into that thought process that had trained myself accidentally do with thinking about other people's thoughts about me. And then my presentations went way better. And people were really excited to hear me talk. And then over time, I just kept doing that. And just kept that in my mind, and I got better and better. And now, I don't even feel like I don't need Apollo. I like having it with me when I talk, but I don't need it. And it's made presentations and public speaking events actually something I look forward to very much, which is great.
Wow. Let's unpack this. Let me ask you this. Did you explicitly mention that you were wearing the Apollo and that it was helping while you were giving presentations on the Apollo? Like, did you explicitly mention, hey, unless I had this on, I would have had some trouble, speaking on behalf of this research?
I did not, because at the time I wasn't sure. We had never tested this in this setting before. It was just, several years ago. So I didn't know that it was going to make me present better. So I didn't actually mention it at all. It was during the experience, just what I was noticing about myself, and that I was just more present, more in the moment, more thinking. I was just presenting. You know what I mean? I wasn't thinking about presenting, or I wasn't thinking about what other people were thinking about my presenting. I was just presenting. I was delivering what I was there to deliver. And when I looked back at the way after the fact, when I looked back at the way that I presented, and then I looked back at in those situations where I was using Apollo and compared how I was feeling and the responses I got to the way that I presented prior to using Apollo, it was completely different. I could feel my heartbeat not increasing, right? Yeah. I could feel myself not sweating. I could feel my breath rate even, right? And I think especially the sweating, like when you're sweating on stage, it's like one of the most uncomfortable feelings to have. And so I think noticing those little things, I started to become more aware of my body, and everything just went that much better. And it grew over time, right? It wasn't just a one-time thing, but I did notice it very quickly. And then over time, as I practiced with Apollo, I became, much better at doing it on my own, almost like it was like a training tool for me, which was really helpful.
So that's definitely one of the topics that I wanted to dive into with you, is how something like this, how this kind of touch therapy for stress can improve your endogenous ability to achieve these relaxed states and to support your performance. So in a way, it is training. It's not like you're going to depend on the Apollo for this kind of effect. Is that right?
Right. Yeah. And it's training in a very similar way for those who know about cognitive behavioral therapy with exposure, which is our leading treatment for phobias and PTSD. That's non-drug. It works in the same way. So it basically, but it's wearable. It doesn't require a therapist. So you give yourself some safety stimulation through your skin, touch being our most powerful safety system in the nervous system. And soothing touch activates that system and decreases amygdala activity, which is our fear center that blasts off when we're detecting too much uncertainty or too much newness or scariness in the environment. When you send a safety signal to that part of the brain, when the brain is trained to perceive threat in those situations, it settles it down and reminds us that we're safe, and our survival response, that sympathetic fight or flight response, doesn't need to kick in right now. And then you can settle your mind back into your body and be present in the moment. But if we don't feel safe, it's very, very difficult to center ourselves in the moment. So, deep breathing does this, meditation does this, self-touch does this, holding hands and getting hugs from loved ones does this, and pets. But when we don't have and therapists as well, but we don't have all those things around us and it's just us, that's when things can get hard. And so that's why we developed Apollo, was to be able to give us that ability to access those states of calm, clear, collected presentness or flow, different ways of describing it, at any time. And then it trains us to remember that we're actually in control of our safety a lot more than we thought we were. And then we make decisions from a standpoint of strength rather than fear and vulnerability. Does that make sense?
It absolutely does. And if I'm not mistaken, I believe that some kinds of ADHD and ADD, they can also be treated with CBT, cognitive behavioral therapy, very, very effectively. And in fact, I suffered with ADD for a very long time. And because I was on medication for it, I suffered. That's when my public speaking skills suffered, right? Classic amphetamine use, you stutter, you start to overthink and such. And so that was my biggest fear growing up. I've had a chance to do what I love, to host a podcast, to speak to professionals like yourself, and over time develop these skills. I think the Apollo has definitely taken that to the next level. I definitely noticed, and actually it's a funny circumstance, because I was supposed to wear it now during this podcast, except while I was updating the Apollo, I had just switched phones. There was kind of like this weird circumstance where all of a sudden I couldn't use the Apollo, so I'm actually getting a new one. It's a strange circumstance. The Apollo is an awesome device. Don't have it now, but I feel like I don't really need it because I've been able to improve my ability through this kind of training.
That's the key.
Yeah. And one of these things that I wanted to unpack with you is, as far as the touch therapy. Why is that? Why does that tend to be more effective than other therapies? I understand you guys are eliciting these sort of brainwave states through innervation of the parasympathetic nervous system, but why is touch more effective than something like sound?
It's a great question. I wouldn't necessarily go as far to say that it's more effective. It's easier it is easier to induce the safety state more quickly. The best way to think about it is that deep breathing, like all of these practices we're talking about, deep breathing, meditation practices, generally speaking, which are, attention control, mindfulness practices, awareness practices, things like yoga, movement meditation, exercise, healthy amounts of exercise, all of these kinds of things are all effective at and touch and music are all effective at providing us with safety stimuli to our bodies, safety signals to the body. When we think about sound is all around us all the time, and we can be exposed to, usually we're exposed to sound that comes from outside of our general area, right? Unless you have music playing or music, through your headphones or through a speaker right around you, we're surrounded by lots of noise from animals, family, other people's music, construction, weather, etc., the news. All of these sounds end up infiltrating into our consciousness, and they are not necessarily calming, and they're not necessarily sounds that we have control over. So is it that touch is more effective than sound? Not necessarily. It's more that touch overrides some of the overstimulating effects of other frequencies around us, like too much fast-moving visuals or too much fast, loud sounds. And the touch being right on our bodies allows us to activate the system at the body, right? So there's this famous equation in physics, which is that the energy of a signal decreases by the square of the distance from the source. So if you're sending out a signal from a source, if this is the source, the energy decreases by the square of the distance from that source. And so ultimately, if you want to override signals that are coming from outside, you go straight to the body, and then you touch the body, and then that touch is effectively like noise canceling for your body, which then calms the body and calms the mind. So it's not that it's more effective necessarily, but it is very effective because it's local. It's like right on us. Does that make sense?
Yeah. And since we're still early on in the episode, I figured maybe we should describe what the Apollo device looks like for those who are unfamiliar, because it is it's a pretty low key device. How would you describe the Apollo?
Well, I think I have one on my ankle here. I was
going to ask you, do you prefer wearing it on your ankle or on your wrist? And is there a difference between the two?
It's really personal preference. I personally prefer the ankle. This is what it looks like. This is the new white model. And it's a little pod. It's about the size of an Apple Watch that can be with no screen. And it actually works anywhere on the body. So you can wear it on your wrist. You can wear it on your ankle. You can hold it to your chest. We have a lot of people who are like pocket users of Apollo. They'll put it in their shirt pocket or their pants pocket, things like that. And ultimately, it vibrates very gently at vibration patterns that we developed in the lab at the University of Pittsburgh during my research between 2014 and 2018 that use very gentle sound waves. So it's still sound, but it's sound that we can't hear, that we can feel through our skin. And when the skin and that's those sound waves, when felt by the skin, send a signal to the brain that's very, very similar to the signal that comes with soothing touch from a loved one or from a pet. And the rhythms are based on the rhythms that our heart and lungs get to, which is called like a resonant rhythm, where the heart and lungs are working together at high efficiency in different situations, like energy, everything from energy and waking up to socializing and being creative to being clear and focused and doing dedicated, intense work for an extended period of time, to rebuild and recover after intense physical, mental, emotional stress, and then down into the really relaxing, lower energy sound waves, which are the meditation and mindfulness, the relax and unwind, and then the sleep and renew. And between those 7 choices, people can generally use the Apollo to help accomplish most of their goals during the day. So, but in the simplest terms, it's effectively music that we compose based on the neuroscience of the stress response system that's composed for your skin instead of your ears.
One of my buddies saw me wearing the Apollo on my ankle once, and he's like, dude, is this one of your biohacking devices or are you on house arrest? And ever since, I've been wearing it on my wrist. I wear it on my ankle for sleep. And what fascinates me is all the different ways you can use the device to elicit a variety of physiological states. So I've been in social situations where I put it on social and open, and all of a sudden it's like I had a beer or something,
Right.
I'll put it on the focus mode, and I'll do some deep work. I'll put it on the sleep mode for 2 hours and I'll get amazing sleep. And by the way, I've seen I wear the BioStrap, the most clinically validated wearable device, on my wrist every night. And so over the past few months, in anticipation for this podcast, I kind of would wear it like 2 weeks on, 2 weeks off. I did my own little experiment, and there was a definitely noticeable trend in my biometrics. I noticed my HRV went up by about 15%. That's pretty significant to me. My HRV coasted around 110 average. So to get it up to 120, 130, that was really nice to see. I noticed my respiratory rate went down, my resting heart rate went down as well. And everything else in my life is pretty, consistent. So it was very, very nice to see that as well. And let's back up for a second. Can you tell me a little bit about why you guys decided to make this a consumer product, considering that most of your research is focused on, working with patients and working in a lab and research setting? How did this turn out to be a product that someone like myself can use in their day to day?
Yeah, that's also a great question. So originally, the product was, before there was a product, it was just myself and my clinical research team at the University of Pittsburgh in the Department of Psychology and Psychiatry, and we were really highly informed by our patients that we worked with, as you noted. So really trying to do everything we can to help these people feel better. And a lot of the techniques we had that we were taught to use were just not doing the trick, we'll say. Over 50% of the people we were treating with the techniques that we had available were not inducing remission of symptoms. So people were still symptomatic after often years of treatment from PTSD and depression, et cetera. And so we said, well, let's start to look, maybe we should start to look at other things that could help. And that's when our attention was really drawn to the safety pathway, the way that the nervous system balances to respond to stress and recovery, and how this is dysfunctioning in people with PTSD and depression, anxiety. Ultimately, we realized that the fastest way to the safety response system to override that threat response from the fight or flight system, the sympathetic system being overtrained for fear and threat response when it shouldn't be, is touch. And so we did a double-blind, randomized, placebo-controlled clinical trial at the University of Pittsburgh in healthy subjects in 2017. And that showed that without a doubt, we were increasing HRV under stress and we were increasing performance under stress, and they were related to each other. So the more the HRV went up, then the better people did on the stressful tasks, which were very, very hard and very hard to increase performance on. And they felt calmer, even though they were working harder and stressed. They felt calmer with the vibration and did better. And those were all linearly, proportionately related. So that was really exciting. And at that point, Catherine, my wife, who's now the CEO of Apollo, who has the business brains of our company, it was really just, the two of us in my research group at that time, and she was helping us, advising us, and she's like, we got to make some prototypes and see, is this laboratory effect real in the real world, which I think is really, really important to do. And so we took, with her background in technology transfer, she raised us some money. We made 400 prototypes and tested them on over 2,000 people in the real world over 18 months. And we were some of those test subjects, which was really cool. And ultimately what we found is that when I was working in the hospital, particularly in the psychiatric emergency room with my colleagues, which is the most stressful work environment that I've ever worked in to date, and it is something that we all were looking for ways to kind of calm ourselves when we were working there, particularly when it was busy. And we found ourselves passing the prototype of the device between us when we were in the back room between patients, because it helped us feel so much more calm and present, able to write our notes faster, able to do better documentation, and not think about how distressed we are from the recent encounter or series of encounters we had, not spending our precious energy thinking about how much we didn't want to be there in that moment. It just brought us into the moment, and it helped us be more kind and present with our patients. And I really feel that it helped me deliver better patient care. And when I saw and felt that impact on myself, it was very, very clear that this had to be a consumer product. It could not just be for patients, because if it's helping us, and doctors are in some of the highest performing professions that there are, right, and working some of the worst hours and the highest stress levels, if this makes us better, then it can make lots of people better. And that's when we started experimenting with the public speaking stuff and sleep and socializing and general productivity and focus stuff. And so all of that started to become much more clear in that moment, which was really exciting. And now the Apollo technology is available as a consumer product for everyone. No prescription required.
I can't even begin to imagine how you guys must have felt when you realized the kind of technology and effectiveness of the technology that you guys stumbled upon. And of course, with something like that, all you want to do is share it with the rest of the world. I want to do some justice here for those who didn't take a high school biology or psychology class. How would you describe HRV? Like, if you made it simple. I have my own analogies, but I'd love to hear yours.
Sure. HRV is an interesting metric. So it stands for heart rate variability, which is the rate of change of our heartbeat over time. So the best way to think about this is when we talk about our heartbeat, like our heart rhythm, we often think about it being something like 60 beats per minute as an example. And when you think about 60 beats per minute, we automatically think that 1 beat a second, right? But it turns out that time in between each beat is actually changing over the course of the whole minute, because every time we take a breath, the lungs expand, and that clamps down on the blood vessels that are in the lungs because of the high air pressure of lung expansion at different phases of breath, and that changes the heartbeat by changing the pressure that the heart has to beat against. So when our heart rate goes up, as you might imagine, so say we're starting at 60 just to make it easy, then say we stress ourselves with an exercise routine or work, and our heartbeat doubles, right? That means our heart rate goes up to 120 beats per minute. That would be pretty standard for exercise. That means the time between each beat shrinks, which means that there's more beats crammed into every minute. So you have now double 120 beats crammed into every minute instead of 60. That means between each beat, there's less time variability between each beat. And so what happens is we see as heart rate goes up, HRV, heart rate variability, goes down because the beats become more consistently separated between each other. When the heart rate goes down at rest, and that's a sign that we're under stress, which is supposed to happen, that's normal in the moment of stress. When our heartbeat goes down, when we're in a recovery situation, our HRV goes up because each beat has more time between each other beat, and therefore there's more wiggle room between each beat. And so the variability should go up when our heartbeat goes down. And so they're inversely proportional is what it's called. And the reason why that's important is because when we're stressed in the moment, we want our heart rate to go up and our HRV to go down. That's normal. But what happens is when we're stressed, our blood flow gets diverted into our heart, our lungs. It feeds our motor cortex of our brain, our fear response center, and our skeletal muscles, and everything that our body thinks it needs to be sending energy and blood to get out of a fight or flight stress survival situation, which our emails and our work generally are not, right? And so what happens over time is as that system is favoring stress and fight or flight, meaning high heart rate, low HRV, high respiratory rate, high blood pressure, lots of blood going to these survival systems, then the blood and resources get taken away from the recovery systems because there's only so much to go around. And then our reproductive systems and our digestive system and our immune system, as a couple examples, our sleep and rest recovery systems for energy, all of those get depleted of resources over time, which can be represented as low HRV because our body has not recovered adequately. And the lower our HRV is over time, it's a sign that these reproductive, digestion, and other systems that are involved in recovery are not getting enough nourishment. They're not getting enough resources from the body because the survival system is being prioritized. So there's not really a right or wrong number for HRV, but in general, we want to see it go down under stress. And then at rest, we want to see it go up, and we want to see it trending up over time, because as it goes up, it means we are becoming more recovered and more adaptable. And the more adaptable we are, the more we can overcome whatever comes our way. So it's a sign of our adaptation, which is one of the most reliable measures of resilience to stress, or our ability to bounce back from stress that we have available right now.
Yeah, and something I want to add to that, it's an incredible description. One thing I want to add to that is I will personally make decisions based on my HRV each morning, my nocturnal trends. I make decisions about how I'm going to eat, how I'm going to invest in stress management, the intensity of my training. I make different decisions every day for optimal health based on what I see with my wearable. And like I said, the Apollo has definitely helped. So what do you think the next iterations of this technology will look like? Do you think it's going to be a little device? Do you think we're going to see something like an implant? What do you see as the logical next steps as far as new iterations for something like the Apollo device?
That's a good question. I mean, I think it's a little bit hard to tell because it's still early days. What I can tell you is we're really trying to stay on the non-invasive side of the spectrum. So in non-invasive, I mean not implantable, not something that requires surgical procedures or procedures at all, something that, keeping it in the way of anybody being able to access it easily, and there being as few to no potential risks. I think that's really the primary goal. So the safer, the better. And all of this is about people feeling safe and reaffirming a sense of safety, and that we have control over our safety. So to that point, in order to help people do that better, we're developing a lot more interesting instructional content that helps guide people along their journey, really helping people understand that the healing journey is one that we all want to be on together, right? That it's not just about depriving ourselves of gratification. It's about and delaying gratification by avoiding junk food or whatever. It's about recognizing that eating poorly and putting bad fuel in our high performance vehicle of a human being that we are is actually preventing us from achieving our full potential. It's actually stifling our ability to thrive as human beings. Not moving when we can, not getting some healthy movement every day, focusing too much with our attention on things that we can't control, which we sometimes refer to fondly as vampire thoughts, right? It's like that metaphor of the vampire is things we can't control that are around us. If we only have so much time and attention to pay attention to these things every day, and we spend time paying attention to things we don't have control over, then we feel out of control that much of the time, which causes anxiety, right? And then our stress response goes back up again. So it's about helping people understand these concepts that are relatively simple, but they're hard because we've never been taught them before, or weren't taught them adequately as children. I know I wasn't. And then taking that information and making it easily accessible and then personal to you, right? So once we start to learn about your body, we can say, okay, these are the things that are going to help you the most. These are the patterns of things you can do that are going to help you achieve your goals more effectively for whatever it is you want to do, and then growing with you over time. And I think that's the really exciting stuff to come that we're going to see over the next couple of years.
I think that's an incredible transition into this concept of safety. I think we've addressed several of the key points here. If you look at, for example, Maslow's hierarchy of needs, right? The safety needs are towards the base. If that's compromised, everything else above it will be compromised. And as you mentioned, as we were discussing, people like you and me, we had trouble public speaking, and we were in a state where we felt that our safety was compromised, meaning we didn't have the same blood flow to areas that would otherwise help to support our performance. And it's a performance event like that can change your career, that can teach you what you're good at, what you're not so good at, what can eventually give you the skills and the know-how to achieve something like self-actualization, be the best at what you do, live a very fulfilling life, have an understanding of different cultures and ideas. And so what I am sort of obsessed with when it comes to Apollo is the ability to help satisfy those safety needs through in a non-invasive way. Now, if we were to speak about this more in terms of I don't know if you want to call it philosophical or spiritual, what exactly are you guys accomplishing? And you can take that in any direction that you see fit.
Sure. Yeah, I'm glad you asked that question. I think that what it is we're accomplishing is a couple things. So I think on the surface level, when we think about how we make decisions as human beings, which is actually not unique to us. It's actually, if we look at ancient animals, and Eric Kandel, for instance, who, studied ancient sea snails that are 300 million years old, and he won the Nobel Prize in 2000, I believe, for understanding how we store memories, which is the same way that or almost the same way that these ancient sea snails store memories. And it's really fascinating because what we're looking at is when we are under threat, whether it's real threat, actual survival threat, or perceived threat, meaning we believe there to be threat even though there's not. If we're in those situations over extended periods of time, our decision making becomes tunnel vision, right? Our senses, our ability to perceive things from the environment that are not threat-based, our ability to look inside ourselves and do introspective work like meditation, self-reflection, any of those kinds of things, all of those become compromised because our bodies are saying, and our brains in tow are saying, you're not safe enough to be able to take time to do that right now. You're not safe enough to be able to think about other people. You're too stressed to think about other people's needs. You need to focus on your own needs, right? And so it basically, when we think about this from the psychological standpoint of negotiation tactics, what is the first thing anybody tells you in a negotiation tactic, right? It's always negotiate from a position of strength. Never negotiate from a position of weakness and vulnerability, right? You will get taken advantage of if you do. And we know this. All good negotiators, whether they are in a weak position or not, are always negotiating from a position of strength. And this is like the internal metaphor for the internal negotiation with ourselves and with the world around us. Every time we make a decision is some negotiation going on between where am I at, what's coming at me, and then what do I do about it based on where I'm at and what my goals are for the outcome of the situation. When you start to take people or help people enter into a safe place, especially when they've never felt safe in that kind of situation before. So socializing is a great example, or public speaking. There are many people who have never, ever felt safe socializing with others or in a public speaking situation, which are very similar kinds of stress. When you give those people the benefit, whether it's through a therapist holding their hand or somebody giving them a hug, like emotional support animal or an Apollo, you give them that soothing stimulus to the body, and all of a sudden they have the ability to say, oh, wow, like what I did when I told you about my first public speaking presentation with Apollo. It's like, oh, wow, I actually don't have anything to be threatened about right now. This situation, these people care about me. I don't need to worry about what they think about me. They're just happy I'm here, right? They're just happy to hang out. It's really me criticizing myself that is resulting in the stress and the anxiety that I perceive to be coming from other people. And so when you start to recognize that, you recognize what you're in control over, and then spending more time thinking about what you're in control over, whether that's your thoughts, your breath, your gratitude, etc., your movement, all what you put into your body. As we spend more time paying attention to things we have control over, we start to feel more in control, a larger percentage of the time, which then makes us feel safe. And then most importantly, it restores what we call the center or the locus of control to us, right? So that when we feel in control, then we feel and prove to ourselves over and over again that when we do certain things in a certain way, we can predict a certain outcome most of the time. And again, that makes us feel more in control. For example, when I take deep breaths in a certain rate, I know my heart rate will slow down, right? I know that my blood pressure will go down. I know that I will stop sweating, and I know that I will feel calmer. And my thoughts in my head will slow down just by breathing slowly in and slowly out at somewhere between 5 and 10 seconds in and 5 to 10 seconds out for 30 to 60 seconds. I know that I can slow my heart rate down every time. Think about for a moment how powerful that feeling is when you prove to yourself that you can do it. And all of a sudden you realize your safety is in your own hands, right? and then you feel safe more of the time. And it just retraining our brains to do that over and over and over again retrains us out of those old habits of thinking about what other people are thinking about us, which isn't serving us in the moment. It's perfectly fine to reflect on what other people might think about us afterwards. Set aside some time to do that, but just don't do it in the moment and take away from your present experience, because then you're going to cause the outcome you're fearing in the first place most of the time.
Wow. Very moved by what you just said. I think where I'd like to begin is, how has the discovery of such a promising technology that you've now made so accessible to people, and I assume that over time it'll be even more accessible, how has that impacted your life, knowing that you made this kind of discovery to change lives in this way?
I mean, I could just talk, personally about what the technology itself the impact on my life, similar to you. So the public speaking thing, huge impact. I mean, absolutely game changing, because probably 30% of my time is teaching and public speaking. So for me to have, and to have that much time spent doing something that scares me would have been horrible. So with the Apollo helping me to retrain myself to be present in those situations, it's made a unbelievable difference, priceless difference. And I was never one of those people who struggled with sleep that much, but for me, it was more about attention and focus. And similar to you, as you mentioned earlier, I'm also one of those people who might have been considered as a child to be like on the ADHD spectrum, because I was really active. I loved to run around. I didn't like following rules, and I always asked why and kind of like did my own thing, and didn't like focusing on things that bored me. So all of that combination of things kind of nudges me into the spectrum of what could be considered ADHD, depending on the situation, or ADD at that time. And so my parents were not about prescribing medication, if I could do it on my own. So they're like, you're going to teach yourself how to focus. And I struggled, and I did teach myself how to focus well enough, obviously, to make it through, college and medical school and graduate school and all these things. But it was really, really challenging. And I was not efficient. And I was a slow reader, believe it or not. I was good at learning concepts, but I was very slow at memorizing stuff and committing things to memory. And that was always a challenge for me, especially when our tests that we're tested on, or the way we're tested, is all based predominantly on memorization and not understanding. That was very, very challenging for me. And I can tell you that in the last 4 years using Apollo, personally, I've increased my efficiency in my day-to-day just by being more focused and smoothing out the transitions between these different things that I do on a day-to-day basis. I would say I've increased my overall efficiency as a human being by probably 30 plus, at least 30%, meaning that I'm getting that much more stuff done, and I feel great at the end of the day. Whereas before, I would get 30% less stuff done and feel like shit. I hope I'm allowed to say that.
Absolutely.
So that for me was just an absolute win. And it still accumulates, it's a training yourself to perform, and recover at a high level is a constant lifelong process. It's not something that I think any of us are ever done with, but it really helped me be present with the process and just embrace the process and not spend all my time thinking about, why do I have to deal with this right now? Well, you just have to deal with it because you do, and this is what's in front of you, and we're going to overcome this challenge so we can get on to the next thing. And, you think about how much time each of us spends resisting stuff and putting up like blocks about thinking of like just the question, why do I have to do this right now? What's wrong with me that I am the one that has to do this right now? What did I do wrong, right? All these different kinds of questions are actually very self-defeating, and they put up barriers to us doing what it is we're setting out to do in the first place. So I think from that perspective, it was an absolute game changer. And really, I use it almost every single day to this day for the last 4 years. I don't use it as much as I did years ago, but I still use it every day. And it just really helps me be more productive and get a lot of the benefits of meditation and breath work that unfortunately I just don't have as much time to do because I'm so overwhelmingly busy. But I can tell you also, to answer the other part of your question, that there's nothing that has been more of a privilege for us on our team to be able to know how many people we're helping with this technology, it has been so rewarding to be able to just see people feeling a little bit better and able to accomplish their goals when nothing else worked for them. And I couldn't be more grateful and privileged to be able to work on something like this.
If we take this back to earlier on in our conversation when we were discussing public speaking in a research setting and how intense that can be, it's interesting because a lot of people, when they think of scientific discourse, they think the comment section of their favorite scientific influencers posts, and the truth of the matter is that people that are on Instagram discussing science, they at least have the skills. They're a little more extroverted. They have the people skills to post the content, be online, show their face. Most scientists, if I'm, you correct me if I'm wrong, but most scientists aren't the most social people. They do the work in silence. They're not the best public speakers. They're very cut and dry. They just present the data as is. In that sense, if you take those kinds of thought leaders, and of course, the comment section of a social media post can be intense, but not having the skills that an evidence-based influencer has, and then being in a situation where you're constantly getting constructive criticism from your peers, it can be very, very, very scary. So if you give these thought leaders this kind of technology, imagine the things that you can bring forward in the scientific community and in the rest of the world. So in my opinion, layer one, I'm sure you'll agree, layer one is using touch, a non-invasive means to elicit a more parasympathetic state. Layer two is the impact that this has on leaders and on people that simply want to improve health on other verticals, right? Because as we know, this is one of the foundations of our hierarchy of needs. So let me ask you this question. When it comes to eliciting an effect, let's say that there's this contrast, right, between the times that you're not using of course, there's a training involved and over time you get better with the device, but let's say that you use the device and you notice a big difference. Does that contrast, this greater contrast between the times you don't use the device and the times that you do use it, is that a sort of diagnostic? Like, if we see a bigger change when we wear the device, does that mean that we have a bigger problem addressing our ability to support this parasympathetic state? Should that invite us to look even deeper?
Yeah, sometimes. I think it depends, right? So because sometimes, so it's really about the delta, what we call the delta, the change from before to after, pre to post, in the moment that's most important. So there's two examples of this, right? One of which is folks like you and I, we work really hard. We have to switch between doing lots of things that are different, that require different levels of focus, energy, attention, etc. And we have to switch many times a day, right? And so we might have a conversation with someone that really stresses us out, and then we have to go and do an interview. So in those situations where there's an acute stressor that has really set us off, where our heart rate's up and our blood pressure's up and we're sweating already and we're breathing fast and our mind's racing and we're like, oh my God, I don't know how I'm gonna do this interview right now. And then you throw on your Apollo and you throw on some, if you throw on soothing music and do some breath work, it will also work even better, not required. But you throw on your Apollo and you can see a fairly rapid, noticeable shift that from where you were when you started to what your goal is for that interview. In this case, it would be like turning on Social and Open or Clear and Focused, which would be the most common two that people use for these kinds of things. So that is a noticeable thing. To your point, I think what it is it draws awareness to internally, because touch stimulates this really interesting part of the brain called, and breathwork does this too, called the insulet cortex. And the insulet cortex is the hub of our limbic system, which is our emotional nervous system in our brains that is responsible for understanding and remembering the emotional context of experiences, right? And so what that means is that there are three parts of this part of the brain that get triggered when we experience soothing touch or breathing or anything that's kind of like a physical, any sense really has an emotional component, gets stored. Taste, smell, we know smell is extremely emotional, sound, all of that gets stored in this limbic cortex in three stripes. Stripe 1 is the posterior stripe, which is the interoception stripe. So it's feeling our bodies, being aware of the state of our bodies, feeling our heartbeat, feeling our breath and our lungs expanding, feeling our gut moving and things like that. The middle stripe is the introspective stripe. This is being able to self-reflect, to look at ourselves as human beings, as people, to evaluate ourselves, or self-reflect, thinking about our emotions, our feelings, thoughts, etc. Then there's a third stripe, which is the anterior stripe, which is the empathy stripe. So this is feeling what others feel and sharing emotionscapes effectively with others around us, whether they're animals or people. And so by providing that gentle touch stimulus to the body, you're stimulating predominantly that interoceptive stripe, the posterior stripe, which activates the part of our brains that draws attention back inward, right? And so people become naturally more aware of their bodies, which you would expect because they're being touched. But there is a pathway here that is activating that helps to also connect to those other parts of the brain. And so when people feel safe and they're drawing their attention to the soothing touch, then it also starts to activate the interoceptive part, or the introspective part, which is like, oh, if I'm safe right now, then maybe I can think about myself differently. Or if I'm safe right now, maybe I can pay attention to what you're feeling, right? And so they all start to come together in that way. And using Apollo for an acute stress, like what we were just talking about, where you have a stressful conversation before something you have to do, like an interview, definitely draws attention back to the body and back to the opportunities for growth that we all have in every moment that we might have been ignoring because we were so stressed out. And I think on the other side of it, in people who have a diagnosis of a mental illness or a physical illness where there's chronic stress in these people's lives every single moment of every day sometimes, then what we see is the same thing, but on a much bigger scale in terms of delta. Because when you talk to some of like our patients many of whom were veterans with post-traumatic stress disorder that they had for decades without relief, many of these folks don't remember what it feels like to feel safe. They don't even have that memory recall. When you ask them, they say, I don't know, or I don't remember. And you can imagine for a second how scary that would be for someone to have been training in stress for so long they don't even remember what it feels like to feel safe. All of a sudden, you put the Apollo stimulation on that person's body, and what we see is people's shoulders coming down, their entire facial musculature relaxing, their voice speed slowing down, the amplitude, the volume of the voice comes down, they start talking differently, they make eye contact, and they have told us, especially in these veterans populations and the folks with PTSD, that I don't even remember the last time I felt like this, where I could just be present and feel safe with myself. I mean, just incredibly powerful. But it's really that delta, right? So when we are in a state, it's that difference between pre and post. If you're already feeling great and you take an ibuprofen, you're probably not going to notice the difference. But if you're feeling like you have a horrible headache and you take an ibuprofen, you'll notice a pretty big difference. It's no different with Apollo and with lots of other medicines. If you're feeling like you're at the top of your game and you use it in the moment, you might not notice it. But if you notice a huge difference, then it might be a sign that there's something going on underneath that maybe should be addressed to help you on your healing journey moving forward.
So if we were to summarize this in one sentence, it'd be something like, this is a safe, non-invasive way to show you what you're capable of. Oh, and by the way, we're helping you get better at being your best self with this technology. That's really just beautiful. If it's okay with you, I'd like to have a little discussion on how your research in the realm of psychedelics is related to any of this. What are some of the first things that come up for you?
So Apollo, interestingly enough, was actually heavily inspired by my psychedelic research and the research that was going on around the time that we developed the technology. Part of the main reason was because psychotherapy so for those who don't know, I'm also I'm a fully practicing psychiatrist. I practice functional psychiatry, which is sort of the integrated practice of psychiatry and lifestyle medicine, as well as traditional adult psychiatry. and ketamine-assisted therapy. And I'm also trained in MDMA-assisted psychotherapy under the MAPS protocol. And I think what's really interesting is that no matter which of these therapy styles you look at, making the patient feel safe is at the core of all of them. And it is more important in the psychedelic world, psychedelic assisted therapy world, than all of the others. I mean, it's critical. It's foundational, as you said, right? With thinking about Maslow's hierarchy of needs, safety is absolutely critical for growth and change. It's critical for learning. We have to feel safe to be able to learn new skills and to be able to embrace those skills. However, in the psychedelic space, people are taking a medication within the psychotherapeutic environment that makes them vulnerable to suggestion, in particular, from the therapist and from things they experience, and that really need some interpretation oftentimes to help them understand what's happening. And so that safety and that trusting bond between the provider and the clinician and the patient could not be more important. And so when I did my trainings in these areas, as I was going through my trainings, that safety thing just kept coming back and back and back, and it never went away. In fact, it actually got more important. And so that really kind of inspired us to really pursue the safety pathway as the primary focus. And so it was very heavily inspired by psychedelic research and the work that we were doing with our clients. And interestingly enough, Apollo is actually helpful within the psychedelic environment. So because Apollo restores a sense of control, but similar to breath work, it has a very similar benefit to the body as breath work, which is measurable. We actually see that people who use Apollo in psychedelic experiences like ketamine therapy have better outcomes. Preliminarily, this is still ongoing, but they have better, and we have lots of practices using it. They have better outcomes, they have less anxiety, and they just feel better going into the experience and coming out. We currently have an IRB approved trial with MAPS, the Multidisciplinary Association for Psychedelic Studies, where we're deploying Apollo devices to people who have been through the MDMA trial for PTSD after they completed the trial phase, so that we can see how Apollo helps them with integration to reduce relapse rates in people with PTSD long after the MAPS trial is done, which is really exciting, and that's recruiting now. And we have a number of studies with ketamine that are starting out too. But it's exciting because Apollo is also the first wearable technology, and possibly the first technology to ever receive an issued patent to reduce unwanted or negative experiences associated with medicine-assisted therapy, right? So you think about the potential when we don't have enough therapists to provide this care to people who need it, and we definitely don't have enough trained therapists, and people are using these drugs recreationally anyway. Now there's an opportunity for them to have tools that are wearable that can help facilitate a safe process for them and to help them understand what's going on and then help them integrate that afterwards. So that's all I can say about that right now, because it's all still ongoing, but it's a very, very exciting time. And there's a lot of overlap between these psychedelic technologies and Apollo.
David, I would love to have you back for a part 2 where we dig deep into that very subject once you can share a little more on behalf of the research. And for the time being, I know that we're very short on time. So if you just want to go ahead and share with the audience where they can find you, learn more about you and your projects and Apollo, I'd greatly appreciate it.
Yeah, it's my pleasure. And happy to come back and chat about this. This is one of my favorite topics. So I really appreciate you having me. And anyone who wants to find us, you can go to apolloneuro.com. If you want to find me in my practice, it's apollo.clinic, APOLLO.clinic. And you can also go to drdave.io, which is my personal website. And if you want to follow me on socials, always happy to chat and answer questions at Dr. David Rabin on Instagram and at Dave Rabin on Twitter.
Amazing. Thank you so much.